Hello and welcome to webinar number 26. We're here in the Spidertech studios, and we're going to get things rolling here in just one moment. We're going to let everyone kind of funnel into the room so they don't miss the beginning, and then we'll get into our discussion about using Spidertech for big toe arthritis. All right, let's get things rolling. A great topic today with big toe arthritis using Spidertech. It's one of those things that isn't thought of as a common way to help with kinesiology tape, but can be a really effective means of helping people with big toe arthritis, bunions, both trying to get out of pain, but also from an athletic standpoint, performance, and playing through injuries. So let's get rolling here, and as we dive in, we at Spidertech, we aim to provide you, the therapist, with the best quality, highest quality kinesiology tape out there. We do that by making it all here in Toronto, Ontario, Canada, from start to finish, and we're trying to make you look good by allowing you to provide the best product to your customers and patients. Myself, chiropractor, I'm doing it for over 15 years, and golf and tennis have been my primary athletic places that I've had the most impact, also just in general practice as well. The significance with this topic for me is both golf and tennis, we need to use the ground so efficiently and effectively from a performance standpoint, but also from a injury prevention, from a being able to perform at the highest level. Any kind of toe irritation, foot irritation becomes such a debilitating issue with the running and the walking that's required to compete in those sports at the highest levels. And then also with both golf shoes, tennis shoes, because you're training so much, they generally will have a smaller toe box and put us in positions where they do kind of promote that kind of toe moving in towards the kind of midline of the foot, creating that hallux valgus issues. And so from a performance and an injury prevention and injury treatment standpoint, using the things we go over today has been something I've used for years and years. We're going to keep our goals simple for today. We're going to dive into how we can help big toe arthritis using Spidertech, and then from there we're going to look at how we can apply the tape in different ways to help your patients. And then my hope with the application piece is that not only do you see some ideas and see how I would tape in different situations, but more importantly, you understand the principles as to why we're taping that way. And so as everyone kind of comes in with their own unique presentation, you can take those ideas and apply the taping you do to their specific needs, versus just here's a diagnosis, here's an application. The beautiful thing, the wonderful thing about Spidertech is not only do they provide the highest quality tape, they also provide options for pre-cut areas of the body that come to you. They're easy, they're simple, they're reproducible. They don't take any time to apply, and so you get the most out of your treatment time with your patients, and you also provide the best quality product, but also something that looks really good and that your patients end up talking to their friends and family about. All right. So as we dive into how Spidertech can help with big toe arthritis, hallux valgus, these are the four areas we're gonna we're going to make sure we cover. We're going to look at how we can affect big toe alignment. We're going to look at how we can impact the arch of the foot. So often we see that the reason for the toe moving inwards stems from the fact that our foot is weak, or we lose our arch, we walk toe out. As a result, we're putting pressure on the inside of the toe versus in between the first and second toes. And then we end up forcing that big toe inwards as a result of our gait. And so a big piece of the puzzle is going to be how to affect and improve the arch of the foot. And then we'll also look at tape versus orthotics and give some ideas as to how we can use both those things to help our patient in the maximal amount. And then lastly, we'll look at ankle function from a fatigue standpoint, from a range of motion standpoint, but also how things further up the chain, for instance, into the core, into the hip, how they'll have an impact on our ankle, and then in turn have an impact on the first toe and arthritis that it develops in there. So, as usual, we're going to dive into the latest research. Everything we go and we present here at Spidertech is going to be the newest, latest, greatest information that we can provide to you, and so you can take the information that we're providing today, but you can also go back and read it for yourself and understand the story that the author wanted to take you on when they created the research. So it is all here for you to look up yourself as well. So the initial one, as we look at the positioning of the big toe, the first is a 2024 study, and it is the effect of short-term kinesiology taping on neuromuscular control and hallux valgus during gait, a study of muscle and kinematic synergy. So a very interesting study here, where they looked at both how toe position, and this is a position that we would commonly see with arthritis. It's a position that as we lose kind of the flexion extension of the toe, we end up forcing it inwards into a hallux valgus position. And then every step we take, if we walk with our toes out, is further taking it into that position, creating a bunion, further affecting the alignment of the toe, further creating more arthritis, and kind of that continual cycle of every step we're taking causing pain, irritation through that big toe. So they looked at how they would tape for that. They also looked at what that does to up the chain muscle-wise as a result of that. So in this study, we see how they tape for our hallux valgus. They are wrapping one piece of tape around the big toe, and then, exactly, over through the inner portion of the foot, over through the abductor hallucis, a common muscle to get irritated with arthritis of the big toe, with the big toe moving inwards, because as you can imagine, as the toe is moving inwards with every step, that abductor hallucis is getting pulled, yanked on every single time, and it's eccentrically responsible to absorb the blow of the toe moving inwards towards the second toe with every step that you take. So they start with a piece around the big toe, pulling it more to the medial part of the body, and then they finish it with wrapping one piece of tape around the entire foot. And this, I'm assuming, would be to get some contact, some connection with the adductor hallucis, which is going to, when tight, going to pull the big toe in towards the second, third, and fourth toe, creating that kind of that stuck position, muscular-wise, of that big toe, and then further leading to joint irritation and joint malalignment, but that muscular piece being pulled inwards. And then what they did was they tested what it would look like, tape versus no tape, during a gait cycle. So they tested all through up the chain. You can see they started in through the pelvis and into the core. They go down through the hip, they go through the knee, and then the ankle and toe positions. They also get EMG testing of all the muscles through there, so we can get a sense of the activation that happens as a result of having the tape on versus not having the tape on the position, or essentially the toe being more corrected versus not being corrected. The interesting thing that we see here is, as we dive into our results, if we just look at our hallux valgus angle, if we look at kind of the far left there, what our angle looks like, which is 22 degrees without tape, and then with tape, we see that jumps to a 18-degree position. Of interest, the tape was on during this study for 1 month, and then is taken off again for the reevaluation. So we see that essentially with having tape on there for 1 month, and then they reapply every couple of days, that we got a 4-degree change in the toe position as a result of with that tape kind of pulling the toe into the correct position. And they used a 50% stretch in the tape for interest. And then we see that as we jump into the visual analog scale, the second category there, so an indication of our pain, we see that out of 10, they start without tape at a 2 out of 10, and that if by adding tape on for 1 month, and then again taking the tape off, we see that it takes it down to 0.8 out of 10. So a significant drop in our pain scale, a significant improvement in our angle of our toe by applying kinesiology tape to correct that toe position. And then they finish, or they mention that the results of our study showed a significant decrease in hallux valgus angle after 1 month of kinesiology tape intervention, which is consistent with other findings. Simultaneously, the reduction in our pain scores indicates that kinesiology tape effectively alleviated local pain sensations. These improvements may result from temporary correction of the hallux position, causing reduced pathological stretching of the medial ligaments and joint capsule. Consequently, pain in the area of the foot was reduced. Furthermore, the smaller, and they also checked the positions, the center of pressure in through the foot. The smaller center of pressure values in the tape group than those in the hallux improved versus just the no tape group. Suggests that kinesiology tape gait improves gait stability in patients with hallux valgus. And then they concluded that there is no significant difference in the number of muscles and kinematic modules between the groups, between the control, which is young, healthy people, and the hallux valgus group. However, the hallux valgus group required more supplementary activation of the lower limb muscles. So we stop there for a moment. What we see is that compared to the tape, which corrected the toe position, the group that didn't have tape on required a greater use of all the other muscles through the lower leg, through the thigh, through the hip, through the pelvis, in an attempt to stabilize the foot and correct things, versus when we had the tape on, everything else was able to stay quieter. We didn't require the rest of the body to kind of compensate or make up for the fact that the toe position was pathological, or at least was not ideal. And so, based on the validation of clinical indicators, muscle synergy can be considered as an additional tool for a hallux valgus diagnosis. The results of this study may contribute to a better understanding of the kinematic and muscle control mechanism in hallux valgus, and provide a theoretical basis for rehabilitation of kinesiology tape intervention in patients with hallux valgus. And so, how we kind of pause there for a moment and we jump into how we are going to tape for this position. We'll go through a video that that gives us an idea how we can apply for these patients. In this video, we're using a roll of tape, and we do, as we kind of play it through here, you'll see that we trim it to provide essentially comfort around the toe. So you see there, we kind of gave that a little bit of a trim to begin with. We ended up about half or 1 inch left of the tape that wraps around the toe. Depending on the size of the patient, you can decide how much of that trimming is required. Because we don't want the tape to exceed the length of the toe, and then it kind of gets bulky and bunched up. As we wrap it around the toe, we can pull it towards body midline or abduct away from foot midline, and that gives us our mechanical or biomechanical support of the big toe. And then my thought from there was the muscles that I want to cover is going to be the abductor hallucis. It's going to be the inner part of the medial part of the arch, which I mentioned before, commonly will be essentially pulled as the big toe moves inward, and then we kind of toe out and pull it further inwards as with every step. So I wanted to get some support over top of that inner part of the arch, and then from there, a lot of times we'll see that dorsiflexion limitations will be a big part of the issue why we toe out, why we have weak arch, why we have a kind of a fallen arch, or why we are forced to kind of walk in that toe out position. So I attempted to go from big toe mechanical correction, support for the inner foot in the abductor hallucis, and then get up and through the calf to maximize the dorsiflexion and through the ankle. And so this would be a common way that I would attack or approach someone with the big toe arthritis or just purely hallux valgus. I guess you can appreciate that as we kind of look at the medial arch for a moment, I think it's easier to kind of visualize and how tape has the benefit with pregnant moms. We get tape on the abdomen, and we don't really have to pin the abdomen down. In fact, that leads to more problems. What we want to do is just kind of get tape over top of the abdomen, so that as we move, we essentially helps you decelerate the forces that the increased size with the pregnancy causes. So that's my thought with the inner part of the foot here, is that I don't want to stretch the heck out of the tape going over the inner foot. I want to just provide that little bit of support, a little bit of awareness, so that the foot can help decelerate those forces better as we walk with toe out. And then with that being the case, and with the ankle motion improving with dorsiflexion, hopefully we can get that toe to move out into a more ideal position, and then also help walk toe straight, which would be our eventual ideal situation. So as we try to bend or decrease the effect of arthritis, we want to be able to get that toe into a straighter position and allow them to walk with that toe in more of a straight position. Okay. To support that idea, and I guess as well to get us thinking about how we can tape in different ways. This is a really clean, easy study, 2023, that looks at the benefit of providing support for the fibularis group of muscles, fibularis longus and brevis, and then also the tibialis posterior. So with this study, we look at the comparison between the effects of tibialis posterior versus fibularis longus kinesiotaping on foot posture, physical performance, and dynamic balance in young women with flexible flat feet. So again, this kind of takes us into the cause of our arthritis, which would be our flexible, weak, flat feet. And then how we can use tape to help support or create a more normal or ideal arch position, which is going to help allow us to, again, walk straight with the feet and prevent arthritis, or once we have arthritis, allow us to get away from the positions that further exacerbate it. Really simply, we see that how they tape in this study. I mean, it's simply wrapping the tape around the medial and lateral side of the foot. Really nothing I was going to say special, but like nothing that's extraordinary here, but certainly effective. That's the beauty of it. And so we get this on here, and we see that instantly, compared to not having tape, we see that the foot posture index, which is the ability to keep the medial and lateral positions more secure, a 25% improvement by having the tape wrapped around medial and lateral ankle. We also see that the navicular drop test, which is a test of the arch of the foot dropping inwards, essentially, can you maintain your arch while you're standing with weight bearing, and we see a 21% improvement in weight bearing navicular height with the tape on. So very simply, very effectively, we see that by getting kinesiology tape on the medial and lateral side of that ankle, our foot ankle position is going to stay more stable, more secure, and then as a result, we're not going to put stress on that big toe as we kind of drive it inwards. And they conclude that kinesiotaping of the tibialis posterior can improve the foot posture and physical performance of young women with flexible flat feet. Additionally, kinesiotaping of fibularis longus leads to promising results in the foot posture and dynamic balance in this population. No significant difference was shown between the two groups because the two groups were both taping the fibularis or the tib post individually. In addition to the tibialis posterior, it is suggested that the fibularis longus muscle can be considered a therapeutic target for management of flexible flat feet in healthy young women. We know that just simply by where the fibularis longus attaches, which is kind of to the base of the big toe and the outer, the second and third toe. So that big toe position certainly is going to have an impact on the fibularis group. So the takeaway from this is that if we provide some support for the ankle, if we provide some awareness from the ankle with tape, which doesn't do anything to lock the foot in place, it doesn't do anything to prevent range of motion, we end up with a more secure, we end up with a higher performing foot that is not going to lead to arthritis. And then once you have arthritis, it's not going to lead to the continual worsening of that arthritis. All right, so another big piece, if we look at where we end up causing further issues with first toe arthritis, would be once we're fatigued. That's where we end up putting less stress on the joints. That's where we end up cheating, walking without proper mechanics, and that's also where those improper mechanics lead to the beating up, the stressing of that first metatarsal joint, causing that big toe arthritis. And so in this study, which is a 2024 study, we look at the immediate effects of kinesiology taping on muscle strength, static balance, and proprioception after eccentric muscle fatigue on the ankle. And so we look at a lot of things here. We're looking at strength, we're looking at balance, we're looking at positional awareness, and then we look at all of these things after we are tired. And the fatigue strategy they used was a plantar dorsiflexion with resistance, and then once the people in the study got below their 50% capacity to dorsiflex and plantar flex, that's when they considered them to be fatigued. And then once they did that, they looked at what had happened with using tape versus not using tape on our performance. And so they looked at a number of different taping strategies here. So the taping strategy number A, that's our kinesiology taping group. We see that very similar to the study that we just saw with the tib post and fibularis group. We see that the tape kind of wraps around the medial longitudinal arch, goes under the foot, up the fibularis group, and then in this case it wraps around the arch and up through the tib anterior. They also looked at what the results would be in athletic taping. They looked at what sham taping would look like in group number C there, where they have it just on the outside of the lateral ankle. And then they also looked at what it looked like comparatively to no tape. And if we look at the positional awareness to begin with, we look at A and B as plantar flexion and dorsiflexion. We see that the air, the reproducible, they're able to reproduce the called upon ankle or angle that was asked upon them was improved with our kinesiology tape group in black versus all three other sham, no tape, and athletic taping. And for a specific number, we see that with our proprioceptive results, we get a 30% improvement in our plantar flexion positional awareness. We get a 53% improvement in our dorsiflexion positional awareness, all compared to not using tape, and all with using our group A or our kinesiology tape group. And I will mention that this is all after fatigue. So we would expect these results to be kind of lessened in non-fatigued, but over and over again in fatigue protocols, whether you're studying the hip, the knee, the core, the ankle, when we add kinesiology tape after a fatigue protocol, the group that has tape versus no tape will always get very close to the pre-fatigue category. So over and over again, we reproduce the idea that the tape gets us back to our pre-fatigue status. It doesn't get us past that. It doesn't make us super good. It doesn't make us extra good. But what it does is it eliminates or limits the effects of that the fatigue protocol has on our body. And then if we look at our balance position, we see a 47% improvement with the eyes closed and a 39% improvement in total sway area. And then we see with eyes open, we see a 51 and a 17% improvement in our total sway area from area and length with eyes open. So again, both eyes open, eyes closed, we see a huge improvement. We would expect with the eyes closed that we're going to see a little bit we're going to see that bigger improvement because we take away the visual perception of where we are in space. All of a sudden, we rely more on the position of our ankle and the mechanoreceptors and through our skin that are going to give us our brain the awareness of where we are. So as we take away the visual sense, we rely more on our proprioception, our mechanoreceptors within our skin, and that's where the tape has the effect because it has elastic property in the tape. It lifts the skin. It provides constant feedback, constant interaction with those Merkel cells primarily, but all of our mechanoreceptors that is going to feed the brain information as to where we are in space. And so that's where we see that as we take away the ability of the rest of our body to know where we are in space, that's where the tape has the biggest effect or the biggest help. And then interestingly enough, as we dive into our strength results, across the board, any position, any angle, whether in dorsiflexion, plantar flexion, different angles of our ankle, we see that in black, our peak force, our peak torque are all improved by using kinesiology tape versus no tape, sham tape, or athletic tape. Which, again, if we're thinking going back to our big toe arthritis or just overall performance, when we get tired, when we get fatigued, that's when we're going to start to kind of cheat. That's when we're going to toe out. That's where we're going to walk in a position where we're trying not to stress our muscle. And as a result of that, we sacrifice our joint position. We sacrifice the integrity of our joints, leading to arthritis, or if you already have arthritis, causing an exacerbation of the arthritis, just as a result of kind of pushing the big toe into a position where it's already irritated and the joint has decreased in space. And as they conclude, the study showed that kinesiology tape significantly enhances muscle strength and proprioception after eccentric muscle fatigue on the ankle more than other taping methods. Furthermore, kinesiology taping surpassed athletic taping in improving static postural control post-ankle fatigue, muscle fatigue. These insights can guide healthy individuals in choosing the suitable taping technique to quickly recover muscle strength, proprioception, and static balance affected by eccentric contraction-induced muscle fatigue, thus lowering the risk of ankle injuries or big toe injuries. Okay. If we jump into, again, another precursor of arthritis, commonly we'll see that an injury will jam the big toe, that big toe range of motion, that joint integrity never is regained. And so as a result, we don't ever express the range of motion of the toe that was needed. As a result, at any time we do try to express the range of motion of the toe, it becomes irritated because it is jammed up, and all of a sudden we don't have the proper joint glide, we don't have the proper space in the joint surface, and so we end up creating the environment for arthritis in the toe as a result of an injury that happened a long time ago. So with this study, it is a 2024 study, again, very new. From injury to rehabilitation, how kinesiology taping helps patients with first metatarsophalangeal joint sprain, otherwise known as turf toe, in pain reduction, gait parameters, and functional ability improvements. In this study, we see how they taped for their turf toe. Turf toe commonly as a result of hyperextension of the big toe, and so you can imagine here that this application is designed to create flexion in the big toe. It's designed to limit the extension of the big toe to help it heal properly. And so as a result, what we're trying to get here is both in allowing the big toe to kind of be supported by moving into flexion. It also allows the big toe when it's moving into extension. An example here would be as you're toeing off in gait. As it's moving into extension, the tape is helping to guide eccentrically or support the toe eccentrically as it goes into extension. So I think this makes great sense as to the application that we would see. It also very much resembles the tape application we saw with our first video, where just in this case they use a thinner piece of tape, where we got maybe a little bit more over the medial arch, but this is very similar. What I did like about the study, and which makes sense, is that they use a very robust exercise program as a control group. And as you can imagine, they're not going to just allow people with turf toe to suffer and to miss their window of opportunity to heal. And so all three groups that was in this study, they used this exercise protocol, which I think makes great sense. In addition, there was the other groups where they used kinesiology tape that was put on with zero stretch, and then the last group, the intervention group, was what kinesiology tape was put on with a 50% stretch. And as we see in the next group, it highlights exactly what I mentioned. All groups received 30-minute exercise program 3 times a week for 12 weeks, 3 months. And then the two other groups, the placebo group was no stretch, and the kinesiology tape group was 50% stretch. And so what we see, and we'll keep in mind that we would expect with this exercise program very impressive results. This alone should be very beneficial for our turf toe, and it was. We look at our pain scale, our VAS score. With our control group or exercise group, we take over from a 6 to just over a 2 within that 3 weeks. Within our kinesiology tape group that we have a 50% stretch, we go from over a 6 out of 10 to less than 1 out of 10. So that's pretty much back to full recovery, or an 65% improvement with it, which is very significant. Interestingly, we see just a slightly better improvement, a 65% improvement in the group that was tape without stretch compared to our group with just the exercise programming. But at the end of the day, all fantastic results that came from rehabbing our turf toe injury here. Exercise and tape all providing excellent results in pain. As we move down, we look at our 6-minute walking test, which is how far you can walk within 6 minutes. And we see in our taping group a 21% improvement from our pre-treatment. As we look at other variables here that they looked at, our stride length improved by 10% in the 3 months. We see that our step length by 10%, our stride length in 9%, our cadence improved by 9%, and our velocity improved by 8%. So all impressive results seen with using a 50% stretch in our tape, all better than a very well put together exercise program for turf toe. And what they conclude is, based on the findings of the current study, kinesiology taping is a beneficial supplementary strategy in the treatment of turf toe. Kinesiology tape has the potential to reduce pain, improve gait characteristics, and improve functional capacity in those with turf toes. While it cannot be used in place of traditional treatments, it is a useful addition. Further studies should be conducted to assess the long-term effects, different kinesiology tape application methods, and tailored treatment protocols on turf toe. It's an interesting thing to say that it can't be used in addition or to take the place of, because that was not tested here. I guess that's what they're getting at, is that all groups received exercise, but we saw that with providing a 50% stretch in the tape, that there was a significant improvement over our exercise alone. I would say that in most situations, my bias is that a stretch, we want to lessen the stretch in through the tape, and we're still going to get the benefits in through the interaction with the skin. But in this situation where where the range of motion is pain producing, it makes great sense that we're trying to eliminate or limit that by providing stretch in through the tape. If we're thinking of those flexible, weak, flat feet, the common intervention here is going to be through an orthotic. And so with this study, we look at using exercise plus tape versus exercise with an orthotic to look at the results. This is, again, a new study, 2025, looking at the impact of foot muscle exercise with kinesiotaping versus prefabricated orthosis on balance in obese adults with flexible, flat feet. We get a sense of what the tape application looks like. Very simple, bare bones as you're going to get. They're just providing a little bit of tape around the arch of the foot. They didn't get very. They didn't do much here to have an impact on anything other than just providing a little bit of wrap around the medial longitudinal arch of the foot, which is great for their purposes here. And they conclude that both foot muscle exercise combined with kinesiotaping and foot muscle exercises combined with insole foot orthotics are effective in improving static balance, dynamic balance, and foot posture in obese individuals with flexible flat feet. However, the combination of foot muscle exercise and insole foot orthotics provides greater improvements in dynamic balance and navicular height compared to the kinesiotaping group. This suggests that adding insole foot orthosis to a structured exercise program offers superior benefit for enhancing arch support and functional stability in this population. Therefore, for optimal management of obese flat foot, incorporating insole foot orthosis alongside targeted foot muscle exercises as recommended. This conclusion makes me think that there was whether there is a bias or they had intended results, or they're just looking at this in a very microscope way. But regardless, when you look at the results here, the difference between the orthotic group and the tape group was minuscule. It was greater in the orthotic group, but just by a tenth of a percentile. So what my recommendation is here is that both the tape and the orthotic provided a lot of support. They provided a lot of benefit. And so my thought is that it'd be a great idea to be using both of them in this situation. The orthotic certainly is going to provide a structural help. It's going to make it so the foot can kind of fall into the orthotic and get used to that. The tape is a little bit more unique because it provides support even when you're not wearing your shoes. And so from a long-term standpoint, the tape is going to be beneficial because you're using it all day, every day, not just when you're wearing your shoes. And so from that standpoint, I think you can get a maximal benefit from combining both those things. When they're wearing the shoes, you can have an orthotic in there, which is going to be very helpful. When they're not wearing the shoes, you continue the tape function, and that they build strength in that position of the foot where the arch is improved, where that navicular is raised. And so we don't have a big difference between we're at home and we're not using our shoes versus we're using our shoes and we have the mechanical support. So from an all-encompassing standpoint, I think we from a greater view, we can have a impact on our patients 24 hours a day, 7 days a week. Anyone who has flat feet, by incorporating orthotic with taping, and then getting the results as fast as possible, and as well as we don't have those times where we're not wearing the orthotic, that the arch falls in. We tend to toe out, and we end up stressing that big toe out as we did before wearing the orthotics. And so I think that is an excellent suggestion based on these results. So this would be a common way that I would recommend taping for having an effect on the arch of the foot and the medial longitudinal arch. As you can see here, we're starting on the lateral foot. We're wrapping the tape around the inner part of the foot. I'm careful here not to provide too much pull or traction stretch in the tape as I go around the bottom of the foot. I don't want to I don't want to pull the skin of the plantar side of the foot up into the arch. I want to make sure that we can provide a little bit of support, but I'm not pulling that skin in any direction, which could lead to some irritation. So I'm not going to give too much stretch as we go underneath the foot. As we get around and up over top of the arch, we can provide a little bit of extra stretching through the tape at that point, promoting kind of that arch to be maintained. And then as we get over top of the lateral of the ankle and kind of into the lateral part of the leg, that's where we can choose to either go up into the fibularis group. We can choose to go up laterally. We could go even further up into the calf if a tight calf, ankle dorsiflexion limitation was part of the problem for the flat feet. So you can continue up in any direction, covering any muscle you want, with the idea that the tape is going on the skin. It's providing constant rubbing because it has elastic property and it lifts up your skin. So it's providing constant feedback to that skin. That feedback helps normalize the tension in the skin. So whatever muscle is underneath the skin in that area, we're helping to normalize the tension in that muscle. So if it's the fibularis group that we're after, fantastic. If it's the calf that we're after, fantastic. And again, we could even wrap it around further and get it over top of the tibialis posterior if we wanted to have an effect over there. So for your individual patient, we can tailor the taping application to whatever their specific needs are. And Our last study that we're going to dive into here looks at how we can have an effect on the ankle by taping elsewhere. So how we can get to the problem and affect the ankle downstream. And so with this study, we looked at the effects of kinesiotaping on hip abductor, so over top of glute medius, muscle strength, and EMG activity in athletes with chronic ankle instability. So athletes with chronic ankle instability, that will lead to change in mechanics, that there's a probability that will lead to foot, ankle, big toe arthritis in the future. And so the benefit of this study is we want to get at the spot in the body where we see the dysfunction. If we see the dysfunction in the big toe, we want to tape there. If we see it in the ankle, we want to tape there. If we see it in the hip, well, that's where we want to tape. We want to get to the spot. We want to solve problems where the dysfunction is with our tape, and then allow the body to express its own mechanics in the optimal way. So with this study, these people with chronic ankle instability were getting tape just over top of that glute medius. We see this tape application, super easy. The greater trochanter is in between the two applications. And the very interesting thing about our study here is that we see, as a result of putting tape on the glute medius, that we end up with a stronger hip, a 9% increase in our strength. We also end up with the 8% normalization of our resting muscle tension. So not only do we end up with a muscle that performs with greater strength, we also end up with a muscle that at resting tension, it's not hard as a rock, it's not protective, its tension is normal as we would like it. As a result of that, we don't end up with fatigue, we don't end up with a muscle that's constantly being low grade activated, but then can't go and perform when the time is right. And so, as they conclude here, application of kinesiology tape is effective in increasing muscle strength and reducing the EMG activity of the gluteus medius muscle in athletes with chronic ankle instability with ipsilateral hip abductor weakness. Thus, the application of kinesiology tape can be used as an effective tool in combining hip abductor weakness. Kinesiology tape can be used to prevent injuries, for rehabilitation, as well as enhancing athletes' performance. A beautiful way to sum things up is that, as we see in this study, we mentioned with the foot and through the ankle, was we get tape on there, we can deal with fatigue, we can normalize muscle tension, and we can allow the body to express its mechanics as it should. This is how, if we kind of jump to the next video, we can see this is how we would tape for that glute medius weakness or the glute medius muscle tension, simply by getting tape on our hip. And so my considerations here are, I want to get tape over top of the area where we have the weakness, glute medius. I want to do it in a stretch position so the tape doesn't ever reduce range of motion. We want to make sure that the range of motion of the hip doesn't exceed where the tape can stretch to, because that's where we're going to end up with our skin irritation. So in this case, we're over top of the IT band here with the leg out straight and below the other leg. When we get over top of the glute medius muscle, we stretch the glute medius, and then as we go more towards the glute maximus, we get a little bit of hip flexion, we get a little bit of internal rotation to make sure we don't run out of range of motion and through our glute maximus. All right, and so to conclude things, we look at our goals. We were looking at big toe alignment, our arch control, how we can combine tape with our biomechanical support, combining with an orthotic to maximize results and through their arch. And then we also looked at how we can improve ankle function, both from a range of motion standpoint through our dorsiflexion and plantar flexion. We looked at how we can have an impact on our medial and lateral positioning of the foot. If we have any chronic ankle instability, we looked at how even we can get tape on our hip to have a impact on the balance, have an impact on our stability and strengthen through our leg and through our hip. So tying it all together, we see different ideas, different strategies to help everyone or all of our patients that we see with first toe arthritis. We'll sum things up with this was everything we went through here today. Great examples of how we can philosophically improve our big toe in a number of different ways. We also saw that by providing the highest quality product to our clients, we end up with doing great things for our business. We ended up making it a business card of our patients as they become conversation pieces as to how much we're helping them, and all their friends I'm sure will hear all about it. And then lastly, let's jump into our Q&A to answer any questions that you have about everything we've spoken today about big toe arthritis. I will mention that this topic for today came from our school's platform. I appreciate everyone's input there, and this was a topic that was brought in from the users there. It's been a great topic to dive into. It helped me gather my thoughts onto how all the ways that I help my patients. Hopefully, it's been a good gives ideas to how you can help your own patients. The school's platform that has been highlighted here, click on there. It is the platform that we house all of our educational information, from a how to use tape, why to use tape, when to use tape. It's all very high quality production-wise information, video-wise information, and it's all for free. It's all housed there for you to learn at your own pace. You can consult it when you have certain patients coming in as to how you would tape. There's multiple education pieces that will dive into the science behind using tape. I highly recommend you get in there, use that information. It is also can be applied to your non-structured CE credit hours. It is truly the one-stop shop for the best information in kinesiology tape. I briefly showed the abductor taping on anterior leg. The previous taping. So, Diana, were we speaking of a video? Are we talking the hip abductors or the ankle abductors? Maybe that one, Angus. Go back there for a sec. Right before the glue. I think that's the one. We did not show one on quads. So, Angus, it would be, if you go back, it would be further back. Like at the very end here.
Like very end?
Yeah, it would have been with this last study for like the glute medius one. So this study right here. So go back for a second. So there's this one where we get into the glute medius, and then the picture before was just, it was on the lateral hip as well. So it was on the quad. Yeah, so that is the lateral hip. So that one we would tape in a glute medius stretch position. If you wanted to get tape on the hip flexor on the quads, what I would recommend is I'll have the patient sideline, and then I will hook their ankle around my hip to pull their hip into extension and their knee into extension, and then I'll lay the tape down over top of the quad. You can start up even into the pelvis above the shorts or underwear if you want, and then I'll just take it all the way down over the length of the quad. The important landmarks are really to get the tape over the tight areas of the quad, but I find that by being sideline and then using my body weight to pull them into hip and knee extension, I can get the tape on the quad at a stretch position. It's comfortable, and the tape tension is consistent throughout. Yeah, there we go. Angus doing his great work. Excellent. So this would be how I would generally tape for quads. And then you can see it also allows the patient to keep their shorts on, keeps their underwear on, and so that they're never exposed in a position where they feel vulnerable. You're welcome. So if anyone here has further ideas as to how we can tape to help their patients, get on there, throw in some recommendations on our school's platform as to different topics we can cover. We have a lineup already of good ideas, but every time that one comes in from our viewers, we put those to the top of the list as from consideration as to topics for further webinars. These webinars go onto that platform as well, so you can go back and look at these for years to come. You can send these to friends, you can send these to colleagues, and you can consult them whenever a patient comes in and you want to go back and kind of relearn about the topics at hand. We're also going to be posting the research papers on there as well, so you can consult the research yourself and kind of dive into that if interested. So without further ado, if there isn't any more questions, this takes us right to our hour mark. I want to thank everyone for being here for our webinar number 26. Time sure flies when you're having fun. We'll see everyone in April for number 27. And it's been a pleasure working and speaking with everyone here. I look forward to doing it again in a month's time. Have a good day, everybody.